Good afternoon, everybody. My name is Dr. Robert Richard, and I'm a bariatric surgeon at the Long Street Clinic Center for Weight Management. First and foremost, I'd like to thank you for joining on our Facebook Live session today. If you're not familiar with our practice, we are a bariatric practice that focuses 100% of our efforts on weight loss. We have an extensive history with treating patients for medical weight loss as well as surgical weight loss. And today I've got a few of my team members with me today. I've got Dr. Miguel Del Mato, a fellow bariatric surgeon. I've got Sheena King, our dietitian, as well as exercise physiologist. And we have Latia Morris, a certified nurse practitioner and medical weight loss expert. So I'd like to welcome you guys. So first, I'd like to talk to Dr. Del Mato. First of all, why don't you talk to the audience about what obesity really is and why treating it is impactful for a patient's health?
Well, thanks, Dr. Richard. Obesity is a disease that affects every single organ system in someone's body. It's not just having too many fat cells or being larger than some number on a scale or in a magazine. It's a process that the body is under constant and continuous stress. And you can kind of imagine that obesity is your engine running constantly in the red, constantly trying to have to work harder than it has to. It damages organs like the heart, the lungs, the kidneys, the brain. Every single system of the body is affected by obesity. So when we as a team are trying to help someone with their challenge with obesity, it's not just about getting to a smaller number or to a lower weight. It's about taking the pressure off that entire organ system that's being affected, helping offer healthier lifestyles, healthier life lengths, trying to get to the root cause by treating that obesity, that disease.
Well, it sounds pretty extensive. So in your experience, what kind of improvements do patients see when they have successfully lost weight?
So that's the absolute best part of this job. Besides getting to work with you, great guys, seeing patients do the things that they were designed and meant for, be able to follow the dreams they have. Being an obesity specialist isn't about me helping a patient just simply be lighter, but be the best possible version of themselves, and the one that gets things done the way they want to, with the people they want to, how they want to. That's what brings me back every single day. I love seeing patients get not just healthier and happier, but just better. And that's a fun feeling as a physician.
I totally agree. Well, Sheena, you are an experienced dietitian. So when we're talking to patients, how does making right choices in diet and exercise contribute to the patient's overall wellness and how they feel?
Well, I believe that making right choices is really the first step into a healthier life, and then also secondary to that, losing weight. I tend to like to think about not just food, the daily food that you eat every day that you think your body needs, but I like for our patients to think about nutrients as medicine. And so when you can help a patient improve their nutritional status and help them make better and right food choices every day in regards to nutrients. And I want to talk a little bit about nutrients for just a second, because you have things called macronutrients and you have things called micronutrients. And those are things that you need every single day to do your work. You have an amazing body and it does amazing things. And so you need to think about not just what types of food that you're eating during the day, but also the nutrients that you get in during the day. So macronutrients are things like protein, carbohydrates, fats, and water. And then your micronutrients, of course, are things like iron, zinc, vitamin D, selenium, copper, some of those things that we need in just minute quantities that you don't really even think about at all. And so I love for our patients to think about not just food, but nutrients as medicine, because every day you get up, you're building, red blood cells, you're building muscle, you're building bone, you have nutrients are what help your immune system stay super, super healthy. And so, our program is really skilled at helping not just do a medical evaluation, but we also do a comprehensive nutrition assessment as well. And so by actually correcting some of your nutritional issues, it can actually help your body want to lose weight. And so when you think about a body that is adequately nourished every day, you're going to feel better and your body's going to want to lose more weight. And we have lots of different tools here that we use to do that. And we also use a very high quality, medical quality food in our medical weight loss program as a protein shake that can actually help people not just, improve their nutritional status, but also help them lose weight.
Wow, that's a lot. But you just had one or two tips for someone to consider maintaining that optimal health. What would that be?
That's a really good question. And there's so many tips that I could give you. And I think one of the most important things is to think, more about your daily nutrition needs or your daily nutrient needs, not so much about food. I do recommend that you know your labs and that you work with your physicians and maybe consider taking a multivitamin or even a high protein meal replacement. And then also we always, recommend here at our clinic 3 meals a day, try not to snack unless you're a person with diabetes. And so those are some tips that are really easy, anybody can follow. But make sure that you check with your doctor regarding your multivitamins. And anytime you start, a program, we can do a full assessment here, and pair you up with the right program. And those tips, like the 3 meals a day, are things that you can do at home. And as you move through the program, we, will help you even get a little bit more skilled with the tips. And that's a big part of what we do is we help you not just lose weight, but we help you keep it off. And so those are just a few short tips that you can start with. And, when you work with our program, we really do help you learn, behavior change.
Very good tips. You're absolutely right. I can tell you that we say those things over and over again in our practice, and patients that are out there that are patients will attest to that. Well, Otia, we often see patients that come into our office who've been battling weight for years. Can you talk a little bit about the factors that contribute to a person to be becoming overweight?
Absolutely. There are several factors. The main factor being overeating, having food that is high in fat, high in carbohydrates, high in sugars. Those tend to cause weight gain. Second would be stress. Stress of your job, stress of your family, those kinds of things. You kind of lean towards wanting to have foods that are high in sugar, high in fat. You try and somehow soothe that craving that you have, or try and soothe the stress level. The third one would be a sedentary lifestyle, not getting enough exercise, working from home, sitting for many hours. That could be one reason for weight gain. Medications. Some patients that I see are on medications that are what we consider obesogenic, where that means that it either causes weight gain or the inability to lose weight. And some of those medications are in the families of mental health or even thyroid disease. We see that a lot. Another one would be underlying diseases related to insulin insufficiency. So type 2 diabetes, we see a lot of that, along with pre-diabetes, which is the second to your type 2 diabetes. Insomnia, not being able to sleep. So then your hormones are out of whack, your cortisol levels are out of whack. With that, you tend to want to crave and eat at night. So I see that a lot in our practice. And usually what I do is I try to get patients to identify these things. And if there's something that I could do medically to make it better, then I do that. But definitely education and letting people know it's probably what you're doing behavior-wise is causing more of the weight gain than anything else.
Wow, that's a lot. Well, I'm a bariatric surgeon. You specialize in our medical weight loss. When we say medical weight loss, how would you describe that to the layperson? What really is medical weight loss?
Medical weight loss is a weight loss program that is led by a doctor, a nurse, some nursing staff, and some ancillary staff. And so what we do is we design a plan for weight loss that also focuses on healthy eating, diet, exercise, nutrition, taking into high consideration your comorbidities. So we don't leave those just kind of hanging out there on their own. We're treating and managing those with you as well with your weight loss.
Well, that certainly is extensive. And I certainly think that a lot of patients who have dieted and exercised before think that that's what they've done in the past. But I think when you talk about true medical weight loss, it's really being guided by a physician that's important. And I think you really touched upon that point nicely. Well, Dr. D'Amato, can you talk a little bit about surgical weight loss program? Just talk about a little bit about what we do and how we manage our patients when we're talking about surgery.
Sure, I'd love to. I think one of the things you've definitely, I think, heard from Sheena, heard from Atia, we look at patients holistically. We look at patients not just as a stomach that walked into our office on a pair of feet, but as a whole person. And where we exist as surgeons is continuing that level of care, that high level of care where we're focusing on the underlying diseases, but having to sit down with someone when the disease has gotten significant enough and serious enough that surgical intervention is worth considering. And we sit down, Dr. Richard, you and I, talk with the patient, figure out where they're coming from, what their goals are, help them assess what surgical procedure that we can offer will get them the best chance at the best recovery, get them back on their feet the fastest, doing the things they want to be doing the fastest. And we have that discussion with them. And what surgery's goal is sustainable, long-term, reproducible weight loss with a goal of, again, that whole person's body being treated by getting to a root cause like obesity. We offer laparoscopic surgery. We offer robotically assisted surgery. So we're able to do our surgeries through small incisions. Some patients are even able to go home the same day. Every surgical option that's out there, we can offer it. So whatever that person's thinking about, whatever they've heard about in the past, what they know from their friends, from their family, from TV, from wherever, we're able to sit down, have a discussion with them, person to person, doctor to patient, and figure out what's right for them, what's right for them and their family. Where are they at and how can we help? How can we best serve? So all the surgical options that are out there, we do them well, we do them safely. And like you said at the very beginning, this is 100% of our practice. This is our Monday to Sunday. This is what we do. This is why we're here. This is how we serve. So if you're looking to have that discussion, that's what a phone call is all about. Initiate the process, start talking to us, and we'll help you however we can.
Well, you're absolutely right. We are a practice that has a lot of options. When we talk about surgery, we talk about things like the sleeve gastrectomy, gastric bypass, duodenal switch. We do revisional surgery. You didn't hear me say lap band because I think we've decided that we no longer do lap bands, but we certainly do lap band removals. So as far as our surgical practice is concerned, you're right. We do have a full-fledged bariatric practice. We are probably one of the busiest practices in the Southeast because all we do is bariatric surgery. We don't dabble in it. I don't do colon surgery one day and then bariatric surgery the next. We only do bariatric surgery. And when you're a patient of ours, you're only taken care of by a bariatric surgeon. We don't have anybody else covering for us. So that is our practice. So if you're a patient sitting there watching this thinking, I've tried that before. I've tried a diet. I've had my doctor prescribe me medications before. So I've been in that kind of program. I've seen dietitians before. I've been in that kind of program. Or even a patient that has had surgery before. I've had that before. And it kind of didn't work for me. What's different about you? Well, I think one of the things you notice that's different about us is that we're all in the same practice. And the way we look at weight loss is I think everything works. I think diet and exercise works. I think medical weight loss works. I think medications work. And I know surgery works. They all work for the right patient at the right time. But this weight loss journey isn't just a single moment in time. It is a long-term management of this chronic disease. And that's how our practice approaches this condition. We individualize a treatment plan. We will move patients in and out of different parts of our practice. It is not uncommon for a patient to be a surgical patient that has a problem with some weight regain that we send to Sheena to have her help them manage their diet and exercise program. It is not uncommon for a patient in the medical weight loss program to transfer to the surgical weight loss program at a different time. So the practice here has all of the tools in the toolbox. So we don't just pigeonhole you into one treatment plan that we have. We'll allow you to move in and out of those treatment plans. And our goal is not just immediate weight loss, but long-term success through multiple attempts at managing this chronic disease. You have to understand that this is a disease, and it is a chronic disease that doesn't just go away because you lost 100 pounds, no matter how you lost it. And that's how we approach this condition. We want to help you manage this condition long-term, and we have all the tools. Now, one thing I know we talked a little bit about, I think that I heard Sheena touch upon it, something called a body composition. That actually helps us a lot with understanding a patient's weight loss or their lack of weight loss in different aspects. So I know Sheena uses this tool a lot. So Sheena, why don't you touch a little bit about on our body composition and how that's different than what somebody might have gotten in their doctor's office or on a scale that they might have purchased on Amazon.
Okay, I'm really glad you asked that question because it is, I think, one of the things that we do, best, and it sets us apart from a lot of other clinics. And this is one of the most, I would think, powerful tools that we use to really assess and really guide our patients through their weight loss journey. And I actually am going to show you a picture of this, what we call InBody. We have a machine called the InBody machine. And this InBody machine, packed on this one piece of paper, is a bunch of health and wellness information that we use to assess and really to see how you progress as your body composition changes. So just take a glance at that. It's called an InBody. And we do these once a month. You'll do it initially when you meet with the doctor or the nurse practitioner, and then we'll get you started on a plan and we'll get you losing weight. And then what's really important about this piece of paper in this machine is that it has a lot of abilities for us to be able to track not just your weight, which is what most clinics do, but we actually track two different kinds, your visceral fat and your subcutaneous fat. This box right up here at the top actually is one of the more important ones because it talks about body organ fat. And so you can actually get on this machine and stay on a plan for maybe 2 weeks, maybe a month, and you can actually lose a good bit of that visceral body organ fat. And that's really exciting for patients to see. There's a muscle fat analysis on here as well. It will break down what your percent body fat is in regards to your skeletal muscle mass. It will give you your BMI, which a lot of people are very interested in regards to your percent body fat as well. And you can't see it, but you might be able to see the bars. There's got bars that move across. What we would like to do is get your bars within the normal range. And so it's a really great diagnostic, really screening tool every time you come in. And it helps patients understand that weight loss and weight management isn't a number on a scale. It is a whole body thing. It is what is really going on with your percent body fat. A lot of times patients will come in here and they'll be all really sad and they'll be really upset because they feel like they, quote, have gained weight. But we'll put them on this InBody machine, and not only will they have lost percent body fat, but they have gained skeletal muscle mass, which is heavy. And so most machines are not going to be able to tell you that. So it's a really helpful tool, not just for the, your provider that you're working with, but for you to take and put in your notebook from month to month. And so you can actually track your own progress, not your weight, but you can track your progress of how you've increased your skeletal muscle mass, lost visceral fat, maybe put on, a little bit of skeletal muscle mass. And so it is an in-depth tool that we can use that is really a very, one of the more important things I think that we use here on a day-to-day basis. And so that is something that that is very valuable, and it helps us guide and take the best care of our patients that we possibly can, because we can explain all those things to them.
Well, I totally agree. I think that is a very valuable piece of technology that we have. It really helps guide our weight loss, both medically as well as some of our surgical patients at different stages in their weight loss. Now, we also do a lot for patients long-term to help them manage this weight. And I think part of it's our support services. Can you talk a little bit about what we do to try to help support our patients in their comprehensive care?
Yeah, and you had mentioned this earlier about weight, and overweight and obesity is something that has to be cared for, long term. And so a really important part of the therapeutic process are what a lot of people call support classes, but I also like to consider them educational classes, because at the time, you go in, you actually are supported, you are encouraged, but you also learn something. And so that's a really important part of growing through your weight loss journey, is understanding that you need to learn some new behaviors so that you can keep your weight off long term. Support group or education class is a catalyst for change. You cannot attend these classes and not be changed. You learn new skills. You're cheerleaders. People are your friends. You have a shared goal. And so the really shared success is what a lot of people do. There's a lot of research that shows that people that come to these support groups actually not only lose more weight, but they keep their weight off long term. They're more confident. They have a new lifestyle. You see that all over our Facebook pages about how patients couldn't do this and they lost weight, and now they really feel good about where they are and what they're doing. A little bit of a development, which I think has been a great development. We're on Zoom, which is awesome. So, during the pandemic and COVID, the telehealth, telemedicine, we now offer our support groups via Zoom and I think Facebook Live for all of surgical and medical weight loss. And so you don't have to actually physically come to the clinic anymore, which is really nice and it's very convenient. So you can be supported right at your office during lunch or right at your own home, maybe after you put the kids to bed. Even if you don't watch some of these things live, you can watch them recorded. And so the support group is a long-term service that we offer that I think is one of the most really critical things, I think, because you don't want to get out there on your own and gain 5 pounds or gain 10 pounds. You need to come back to your doctor, come back to the dietitian, and then first step actually can even be come back to support group. So they're a very important part of what we do here. And it's one of my favorite things to do, because you actually get to see in person live people who were 300 pounds and now they're 150 pounds, and like this guy behind me here who had never ridden a bike before. And now, his whole life is about, good nutrition, good nutrients, and really trying to ride and just enjoy his life. So it's a full total program, and support group just kind of wraps it all up and makes it, more like home, not so much like a doctor's office. We get to know our patients really well, sometimes on a first name basis, if you come to group a lot. So it is a very important part of our program, and we offer a lot of those live and online now too.
I totally agree. That's such an important part of our program, and we continue with that support very long term. It really does make a big difference for our long-term sustainability. Now, Otia, Sheena had mentioned something earlier about New Direction meal supplements. Now, why is that different than what somebody can get on the grocery store or, the Atkins diet? What makes it so different?
It's different in a lot of ways. Just to touch on a few, it's manufactured by a company called Robar, who's been in the weight loss industry for a long time, or medical weight loss for a long time. So we stand behind their product. We know that it works. We have a lot of patients that lose weight really, really well with this product. So the product itself is high in protein, 27 grams of protein per serving, 3 grams of fiber, and 10 of carbohydrates. So some people like to think, well, what if can I just pick up my protein product from Walmart? And we go, no, you can't. It's not the same quality. The protein that's in our product is a protein isolate. You digest it better than you would a protein from something from Walmart, if you will. The ones from Walmart have more of a casein in there, more lactose, which tends to be harder on the stomach for digestion. So with this product, you're going to get better digestion. You're going to get the vitamins and nutrients that you need for the day. Just 3 meal replacements a day gives you 100% of the nutrients that you need for your day. So it's not only helping with weight loss, it's also helping with that micronutrient deficiency that Sheena had talked about earlier.
Now, I certainly think that's an important part of this. And you're absolutely right. You really just can't mimic this with other products. We chose them specifically. We visited their plants. We looked at their manufacturing process. And I got to tell you, all the state-of-the-art weight loss centers around the country, Mayo Clinic, those places, they're using this product. This is a real quality product. This isn't a weight loss product that you're going to get online. This is doctor supervised. I totally agree with that. So Tia, what advice would you give somebody that's about to start their journey at home, and what would you recommend? How would you recommend that they start this?
Good question. There are a few things. For starters, decreasing your portion size. We all know, we've heard that, we need to kind of stop with these meals that are packed on our plate. We teach our patients a lot about portion size, and we give them a visual. So using your hand as the size of your meat, or eating from a very small salad plate, because we just eat a lot of food. As Americans, we just tend to have more food on our plate. If you go to a restaurant, they're going to give you more than you need. Everything is value size. I don't care where you go. So just watching your portion size is one thing. Decreasing your sugar intake, stopping all the snacking, the beverages, the coffees with extra cream, or those things are going to add weight. Drinking more water. Water is going to help with your metabolism. It's going to help to keep you hydrated. It's going to also help with cravings. Getting sleep, 8 hours of sleep a night, at least 90 minutes of those in REM sleep, which is deep sleep. Getting a physical every year, starting with your PCP and seeing if there's any underlying issues that are causing this weight gain that you have. Staying active 3 days a week, some type of cardiovascular exercise. And then lastly, if you don't know what to do and you've tried these things, come by and see me here at Medical Weight Loss.
All right. I think that's good advice. Dr. D'Amato did touch base on surgery. And, we really haven't talked a lot about COVID-19, but I got to at least touch a little bit about how we're keeping patients safe. For a few months, we were not doing elective surgeries when all this happened, just like everyone else. And when we started back doing operations and seeing patients in the office, we've been doing a lot of things to do this safely. And I think we've done a great job without any exposure to patients. We're using telehealth as much as we can. Zoom and Facebook, we do see patients in person with proper precautions, with masking. And we're back in the operating room. We've been back in the operating room for a few months now, and we're doing things very safely. Where, as Dr. D'Amato mentioned, we're getting patients out of the hospital a lot faster than we have in the past. Not unsafely, but the right patient can go home the same day without any trouble. Just because these operations are laparoscopic, and we do lots of things to minimize your pain. So staying out of the hospital and trying to keep you as COVID-free as possible has been one of our number one goals as we restarted things. So I do think both our medical weight loss program with things such as curbside delivery of the products have done a lot to keep this going in this time of COVID-19, when patients are feeling a little stuck at home and where they're gaining a few pounds here. I think this is a good time for us to help patients with their weight loss journey. You can tell on this call that we all take this personally. This is all we do. We kind of really do feel strongly about how well we can do this and how effective this is at changing lives. So Dr. D'Amato, what do you think? What do you think about this lifelong approach to our patients that we have?
Well, I think fundamentally for me, and I know this is a philosophy kind of shared throughout the clinic, I believe very strongly that the best doctor ever said a long time ago that he came not to be served, but to serve. And as physicians, that's what we're called to do, to serve our patients, not just in the 1 or 2 seconds here and there, but as a calling. It's something that we do when we wake up. We're excited to come to work. We want to see our patients, not just the day of surgery. I mean, these surgeries, maybe an hour and a half in the operating room, a few hours to a day in the hospital. But that's not where we do our most successful, most powerful work. What we do beyond the surgery, beyond doing safe surgery, beyond doing things well in the hospital, we want to see our patients for the rest of their life and the rest of our career. We want to be part of that patient's journey. It's a privilege to see somebody. How many doctors go to medical school and they want to see their patients get better? That's kind of why we do it. But how many get to experience that once they're in practice? Most doctors are trying to slow down disease progression. They want to slow down the kidneys getting worse, the lungs getting worse, the heart getting worse. We want to reverse these damages. We want to get people feeling younger, feeling healthier, and then we get to experience that as they grow older, as we grow older, which is happening to each one of us. We want to see that journey. And then when someone is struggling, when someone is having a concern, a question, we want to be there to answer it. And so our lifelong follow-up model isn't just about the biochemistry of the body, which is critically important. It's not just about the emotional health of the patient, which is critically important. It's about the entirety of that patient as a human being that we can help take care of. Sheena does an amazing job educating. Otia is an incredible cheerleader. She's fantastic at what she does. Dr. Richard, I'm so proud to have you as my mentor. This has been an experience that I just think patients, we're not put on this planet as individuals, we're put in families, we're put in communities. We want to be part of that community for that patient for as long as we possibly can. And it's an honor, it's a privilege to be part of it. It is the most exciting and fun part of my professional journey, my professional career. I love what I do. I think everyone here mirrors that. We love our patients. We love the practice. We invite you to be part of it. If you're watching now, please, reach out to us. We'd be honored to serve.
Well, I certainly couldn't put it any better. I tell you, this is a practice that we really take seriously. We care what we do, and we think what we do is important. Patients often ask me, why do you do this type of surgery? Heck, other surgeons ask me, why do you do this type of surgery? I can tell you, I can remember back in my training program, there was one patient that was so impactful to me that I just felt this was probably where I was going to be. This patient was an older African-American female. She had just had her second amputation. She had a dialysis catheter and she was blind. And what was so impactful to me was she was overweight. And that was the image, almost the exact image of my grandmother the last time I saw her alive. And one of my mentors said to this group of residents, what one procedure could this patient have had 10 years ago that would have cured all of her problems? A gastric bypass would have stopped her diabetes, which caused her blindness, which caused her renal failure, which caused her amputations. So when we say we impact lives, we do. That's what we do. And I think we all love what we do. So I'd like to thank you, Dr. Del Monto. Thank you, Otia. Thank you, Sheena, for joining us on this call today. Remember that care for our patients is available in 3 different locations. We see patients in Gainesville, we see patients in Brazelton, we also see patients in Duluth. Feel free to like or comment on this Facebook Live. Send this to your friends and families. If you have any questions or you'd like to see us in the office, 770-534-0110 is our number. Please be safe out there. There is a pandemic. Wash your hands. Don't be afraid to wear a mask. Stay socially distanced. Oh, and make sure you get the flu shot this year. It's important. But thank you again for tuning in.